Thank you for joining this presentation on the Scarsdale Health Plan. This is really a fairly brief overview for new members. The Scarsdale Health Plan is a benefit to full-time employees in certain of our collective bargaining units and for certain non-affiliated personnel, managerial and confidential staff. The health plan is a self-insured plan, which means that the school district budgets for and pays for all the claims of its active members and retirees each year. The benefits of being self-insured are numerous, aside from financial benefits of saving money over time compared to having to purchase an insurance product from the marketplace. We also have the ability to sort of humanize the plan through an appeal process when that's necessary, and just through getting assistance directly from the Human Resources Office when and if that is necessary. So I'll be focusing on a few key things today, and mostly trying to help you by navigating to where our resources and information about the health plan are. First, I'd like to share a very brief summary of sort of the key information that we find most useful in terms of the health plan. And it's sort of this health plan tips and reminders graphic. So first of all, to maximize the health plan benefit, it really makes sense to stay in network. Now, of course, there are out-of-network benefits, but the most cost-effective way to use the plan is to use the network. And we have the United Healthcare Choice Plus network coupled with POMCO Select. And these are both network components that should appear directly on your card, your ID card. In order to find a provider, we encourage you that you use the UMR Provider Finder. So you're going to visit umr.com and click on the Find a Provider icon, and then you're going to search using United Healthcare Choice Plus, and you're going to see an option. If you're logged into your own UMR account, that will actually say United Healthcare Choice Plus with POMCO Select. Make sure you are using your member ID card. Give your card to all of your providers, and give your card to your pharmacist if you're going in. Keep in mind that when blood work is being done or other types of lab work like that, LabCorp and Quest are the in-network providers for that lab work. If you're going to a network provider, a United Healthcare Choice Plus or POMCO Select provider, those providers must obey your wishes to send send your lab work to one of these two labs. And one of the lessons that we've learned over time is that with the consolidation of the healthcare arena, many physician practices have affiliated with hospitals or hospital networks, and they are encouraged by those networks to send lab work to the hospital labs. If that happens, those hospital labs, or that lab work, would be treated as if you had a hospital visit, and you would be susceptible to the $200 annual facility deductible that is associated with the visit and use of a hospital facility. So please try to remember to use LabCorp and Quest for those. The other side of this graphic, what we really try to emphasize is that you take charge of your health care. Just like you would consume information in researching to buy a car or a large appliance or even a home. Healthcare is a major expense. It's a major life commitment in terms of your finances. And we really encourage you to view it like you view some of those other activities, financial activities. That's by being a proactive consumer. So first, make sure you're setting up your own account to monitor on an almost real-time basis the activity in your account. So you would go to umr.com and follow the instructions there to track, everything that's going on. Make sure your dependent information is correct and so forth. If you are using flexible spending, and I'll talk more about that in a minute, but if you are a flex spending participant, we encourage you to download UMR's Flex app. Have that on your phone. It's the easiest way, I've found at least, to submit receipts and verify documentation that the flex people need to be able to authorize flex spending on an allowable expense. Be proactive. As I said a minute ago, make sure your providers are in network unless you're intentionally going out of network. Always ask, are you a member of the United Healthcare Choice Plus network? Doctors' relationships change over time with networks, so it is always important. Just as they should always ask you for your card and verify your copay, in turn, you should make sure they continue to be a member of United Healthcare Choice Plus or POMCO Select. Ask questions whenever possible. If you need to call UMR, please do so. The number is provided here. You can get claim forms right at your UMR site, member.umr.com, and click on Find a Form. Also there are always the most up-to-date summaries and full plan description. Now, we keep versions of those as well, and I'll show you how to access that from our website, but it's also at member.umr.com. And probably most importantly, we're here. We're here to help you, particularly through the transition to coming on to our health plan. So please let us know if you're experiencing any problems, if you have a question. We do have a general email address in our office. It's CO, that stands for Central Office, CO Human Resources at scarsdaleschools.org. And that goes to all four of us in this office. It goes to Pat Gaffney, Deirdre Reed, Carolyn Rossetti, who's really our health benefit administrator, and it comes to me as well, Drew Patrick. Or you can call the phone number there, 721-2415, or if you're in school, it's just 2415. So we felt those are some really important tips and reminders to put out there out front. Now I'm going to shift and go to our webpage. And just to remind you, to get to the Human Resources webpage, you do have to be signed in to your account on the website. So this is just the main district website. I'm going to go to Staff Sign In, and I'm going to go to Active Directory Login, and here we are. I'm signing in, and now you'll notice that the bar changed here from Staff Sign In to User Options. And I'm going to come over to District Information, Human Resources, and for employees, and that brings you to our employee site. Along the top are our key information sections of the site. I'm going to go right over to benefits here. And when I click on benefits, you see the first thing up at the top is health and flex spending. And you see sort of four of our key icons here. Of course, UMR, which manages our plan. Express Scripts, which is the formulary for our prescription drug plan. RX Benefits, which is our customer service arm for the prescription drug plan. They're connected with Express Scripts, but they provide a higher level of service for us, and they also provide some key programs to us. And then, of course, the brand new telemedicine service, Teladoc, which, just to remind you, is a separate network from United Healthcare Choice Plus. This is its own network of doctors, and it's behavioral health, general medicine, and dermatology. So we encourage you, and I'll say more about that in a second. So here's our main page. You see that little tips and reminders graphic I just showed you. It has the phone and website of the three services here, the medical plan, the prescription drug plan, and the new Teladoc service. As we scroll down a little bit, I keep a Google folder here with each of the sort of most up-to-date relevant documents. So right up at the top, the 2020 summary benefits coverage. This was updated to reflect changes that went into effect both July 1st and then August 1st. So if you click on that, this is what we call the short version of the plan. And this can provide you with sort of the highest level information about your copays and stuff like that. So that's one document. We have a similar document for retirees. Next, this is just working alphabetically for the Scarsdale Teachers Association Benefit Trust Fund. You've got the claim forms for I should take dental claim form first, hearing aid claim form second, and a vision claim form third. So you will need to use those if you are submitting for reimbursement. These can also be found on the ASO website. Next, we have a whole bunch of flexible spending forms and information. So here's the dependent care reimbursement form, a guide for employees, flex health reimbursement, and then information about the mobile app that I described, which would prevent you from having to do one of these paper forms. You could just use the mobile app or the website, umr.com or member.umr.com. And there's info about the debit card you would get with flexible spending, and so forth, and an FAQ. Down here, we've got the health benefits summary plan document, and I'm going to spend a second on this. So if you click on that, this is our big booklet. This is a 111 page document, and it's got a whole bunch of information. But one of the advantages of viewing it in this format is you can search it. So let's say you got a determination from UMR with respect to a service that you received, and something wasn't covered that you thought it was covered, and you want to appeal it. You want to say, nah, this doesn't look right. I'm going to just hit Control F here and search in the document for appeal. I can spell it correctly. Excuse me. There we go. And you can see claims and appeal procedures appear on page 80. So I'm going to keep zooming down here till we get to page 80. Here we are. And you can see the appeal process starts right here. There are some things that require predetermination. A major surgery is probably the best example of that. It starts with some definitions. It explains how to submit claims and timely following of claims. Claims are due. The plan operates on the calendar year for claims, and so you've got a 90-day lag for submitting claims from the prior year, so as late as March 31st. It describes how benefits are calculated and so forth, and the time frame that UMR is going to follow to determine claims. And then if there's a adverse determination, denied claims, the explanation of benefits should explain that. And then here on 84 starts the appeal procedure. There's a first level appeal. It's a mandatory. Has to happen within 180 days of the date you receive the EOB. And you appeal that directly to UMR. And if that's denied and you wish to engage in a second level appeal, the steps are outlined here, but that you're actually going to address to us here in Human Resources. So we are prepared to take care of that, and that's directed toward me in HR. So anyway, but this document is searchable, and you can get answers to some of your questions, I'm sure, by looking at that. Another form here is the Canarex enrollment package. Canarex is a separate program we participate in. It's a pharmacy program for a limited number of brand name drugs that if you enroll in Canarex, these are maintenance drugs you were taking every day for some condition. And this program sources those drugs through less expensive countries, quite frankly, Canada, New Zealand, Australia, the UK, places like that. And as a result of sourcing these drugs more cheaply, the copay for you is zero. So that's a special program. You can enroll in that. And then, of course, we have the UMR medical claim form if you're submitting a claim out of network. Over here on the left, we have a summary of the recent changes that have been made to the plan in terms of copays and cost sharing. And a relatively new item here is all about flexible spending. So I strongly encourage you to look at this as you consider whether you're going to start flex spending or how much to set aside. This sort of has all the information you need, links, all in one spot. The mobile app, how to download it, what to do, the debit card, how that works, and so forth. So we hope that you are able to look at that. And then down below here, as of yesterday, we just got, which was August 31st, we received from the STA Benefit Trust their brand new booklet for the 2021 year. So that's down here, and you can take a look at that. Many of you also have a life insurance policy, and that booklet is linked at the very bottom. So really, those are the highlights. We encourage you to use these resources here on the website. If you have questions, reach out to us. Try to be a smart healthcare consumer, like you consume other things, and we hope that you're able to use the plan for what it's designed for, to keep you proactively healthy and take care of those issues and concerns as they arise. Thank you so much. And again, reach out with questions. Thanks.